Next, we will examine movements that occur along a coronal plane. These movements are abduction and adduction. Abduction is the movement of a limb laterally away from the midline. Typically, muscles that cross the lateral side of the joint will produce abduction movements. Adduction is the movement of a limb medially towards the midline. Typically, muscles that cross the medial side of the joint will produce adduction movements. Figure 9.12 demonstrates abduction and adduction of the upper limb. However, the same movement can occur at the hip joint and move the lower limb. Muscles within the forearm can also produce abduction and adduction movements of the wrist as well. Here we will examine the rotational movements, where rotation is defined as a twisting or pivoting movement at a joint, typically along the long axis of a bone or a structure. Pronation and supination are rotational movements that specifically describe movement of the forearm and the hand. Pronation is a movement of the forearm where the palm faces posteriorly or inferiorly at the end of the movement. The direction that the palm faces depends on whether the elbow is extended or flexed. This type of movement moves the forearm and palm out of anatomical position. Supination is a movement of the forearm where the palm faces anteriorly or superiorly at the end of the movement. Again, the direction that the palm faces depends on whether the elbow is extended or flexed. Supination moves the forearm and palm to anatomical position. Figure 9.12 and 9.13 demonstrate rotations, including lateral and medial rotations of the lower limb. The same lateral and medial rotations can also occur for the upper limb. The right diagram demonstrates pronation and supination of the forearm and the palm. So here we will examine some other movements, such as elevation and depression. Elevation is the movement of a structure in a superior direction, while depression is the movement of a structure in an inferior direction. Figure 9.13 demonstrates elevation and depression of the mandible to close or open the lower jaw, respectively. Elevation of the mandible will close the jaw, while depression of the mandible will open the jaw. Elevation and depression can also occur at the scapula of the pectoral girdle as well.